Hello, fellow students of social work. This is a presentation on functional family therapy in evidence-based intervention by Chris Thompson, Brina Smith, and Taylor Norelius. Enjoy!
A concise overview of functional family therapy. First, you begin with the assessment, where you look at the client or clients from a biopsychosocial aspect, where you're looking at things from their diagnosis through the DSM to strengths-based systems that they're engaged with, to biological factors that could be passed down from generation to generation. Next stage would be the engagement stage, where you meet with the family. This is where you meet them. You can meet them in any setting, from their house to your office. And you sit down and you build that therapeutic relationship with the clients and work with them so they can set their goals. Next stage is the behavior change. This is where the family does the work. They take those goals that they created and they begin to implement them. And the last stage, after the behavior change has been done, is the generalization multi-systemic change, where you as a case manager will maintain the case and just kind of overlook it and make sure things are going well and jump in and intervene as needed. The clinician's overall goal: sustain the momentum of change and foster the family's independence from therapy. And this empowers the clients to continue on doing their own therapy without intervention from the clinician. That's the overall goal, is to empower them to be able to make their own change and take control of their own life. Symbiotic theories and models that kind of go along with functional family therapy. It's a strength-based intervention. It's focused on the strengths of each individual within their system and their systematic changes, systematic strengths. So instead of focusing on somebody who has negative quirks or negative things, you focus on the positives and work with those. Another theory that you would utilize within this is motivational interviewing, which is really good in the motivational stage, helping to facilitate the client's motivation. Family systems theory is another one. You're looking at the client and how the client relates within the family. And the ecological perspective, because this is kind of a systems-based intervention. You're looking at the individual, how they work within their systems, and a good tool to use for this is an eco map, so you can get a perspective on looking not just at the individual and the family, but maybe some other systems that they're involved with that will help them be successful.
Okay, so I'm going to go over some of the techniques and principles of functional family therapy. So this is a therapy that is meant for use with families who have a male or female youth who are ages 11 to 18. And these are youth who have had a variety of problems like youth violence, drug abuse, and delinquency, but it can also be used for other issues, which Taylor will address later. And it's a short-term intervention program, so it's approximately 8 to 12 one-hour sessions, and this is something that should be administered by a licensed professional with a master's level or higher. And as Chris said earlier, it can be used in a variety of settings. So it can be used in the home, the clinical practice, in the school, and there's many other settings as well. So there are 5 guiding principles to family functional therapy. You can see them listed there, but we have engagement and change, motivation to change, relational interpersonal assessment and planning, behavior change, and generalization across the behavioral domains. So then these 5 guiding principles are taken and then they're integrated into phases, and they actually have created 7 phases. And this is the outline of the 7 phases. You can kind of see that with some of these you can go back and forth. So there's room for movement in these. It's not a set phase. You can move back and forth as you need to with your clinical analysis, if they need to go back or not, or if they can move forward. So there's the pre-treatment phase, and with this you collaborations. So you would collaborate with social worker or someone who may have referred the family to you, collaborate with them and just kind of get their idea of where the family's at and where the child is at. And then with collateral information, you're going to want to review different things like their school reports, reports on their behavior, if there's any law enforcement reports, anything like that. And you just want to talk to different people that have contact on a regular basis with the family. And then you're going to want to review all this information and then identify what you believe are some of the family's biggest struggles. So then we have the engagement phase, and here the clinician should help the family to empower them so they can gain an understanding what their needs are, and help the family members to build a desire to help one another and become more of a cohesive team. The clinician would also want to identify certain protective factors that the family has, so that you can maybe focus on those as their strength, or you also want to identify some risk factors to see if there's anything that's a major concern that needs to be addressed right away. So as the clinician, like I said, you'll want to identify those protective factors and risk factors, but you should employ your strengths perspective at this point, cultural competency, and especially use empathy, because at this point the family's probably pretty nervous about engaging, since this is a new thing for them. Some activities for the family to participate in at this point would be some telephone outreach to other family members, kind of teaching them how, just because a lot of families when they come in at this point have some dysfunction in their life, and so teaching them some basic skills, using appropriate language and dress in the family, developing respectful attitudes towards each other. Then the second phase is the motivational phase. Within the motivational phase, the goals are to create a positive motivational context within the family and change the meaning of family relationships and help the family to identify those meanings. So you're going to help the family, identify what their motivation is for change, why they want to change, and help them to feel that they want to change on their own, and not that you're telling them that they need to change, but so they can do it on their own. So as a clinician, you're going to want to employ motivational interviewing as a technique. This would be especially helpful. And you're going to want to help them to be able to separate blame from responsibility, and this will help strengthen some of their relationships. As a family, they're going to want to, as activities, they're going to stay away from diverting and interrupting. They're going to work on sequencing and reframing their family themes and creating new positive family themes. So at this phase, this is basically where the clinician will analyze the family and see if they need to go back to either the motivational phase or the engagement phase and see if there's anything we need to readdress, or to see if we can move on to actually work on changing some of these behaviors and moving through therapy. And then with the behavioral change phase, this is the point where the goals are built for interpersonal skills. You're going to want to build goals for changing habitual problematic interactions, and you're going to want to change coping patterns to change that up so families respond differently if a problematic interaction arises. So as a clinician, you're going to want to work on communication training, assigning individual family members different tasks, and using behavioral assessments. And the family activities might be modeling positive behavior, providing directives, developing a family model for change, and remaining sensitive to the needs of others in the household. And then finally we get to the generalization phase. In this phase, this is where you're getting ready to send the family out of therapy and being able to handle family interactions on their own. So this is the point where they're going to extend their positive family functioning. You want them to create a relapse prevention plan and help them to know that they can reach out to other community sources if they need help. And then, so as a clinician, you might want to make some referrals, and you're going to help them to build that relapse prevention plan. And then as a family, they will, like I said, create that relapse prevention plan. This is probably the most important part of the generalization phase. And then they will just discuss their exit from therapy. And then finally we have the seventh stage, which is where you follow up with the family. And if they request it, you would refer them to any community services they need, but they need to identify that on their own.
Okay, so just Brina already talked a little bit about some settings that this therapy can take place in, but these are just some of the populations it's been used with. As she mentioned, it's often used with youth that are ages 11 to 18 who have conduct disorder or oppositional defiant. They also can have alcohol or substance abuse problems, but I also found some research that showed using functional family therapy with delinquent adults and also with children who have cerebral palsy and with their families. So it's been applied to some other areas as well, and I'm going to go into more detail about that. And then it's also employed by DCFS to use with children and families. So the first article I want to talk about is the one that involves adult offenders, and it showed that adult offenders and their families were able to gain a lot of greater family cohesion, less symptoms of distress, and to view their family as supportive and as a resource when using this therapy. So they were able to show that basically it's not just useful for only adolescents, but that this could also be useful for adults who have some of these same issues that adolescents are going through, or similar kind of criminal history and things like that. One of the weaknesses that was identified in the research was that only those with family could use this therapy, and so it was kind of pointing out that this could be kind of a selection bias, just that, and they couldn't just get a good sample. It was only adult offenders who had the family and could go through this, and that kind of was something the authors pointed out as a possible issue. The next one I looked at was comparing adolescents who engaged in functional family therapy with adolescents who engaged in regular probation services in the community. And it showed that functional family therapy was much more effective in reducing youth recidivism with felonies, violent crime, and misdemeanors. And this was tested 1 year from the control group who did probation services after the treatment. And so it showed great increase or great decrease in recidivism. And so that was a really awesome thing to see. And I think it's a really important area to look into, just comparing this with other things in the community that have been tried and showing that functional family therapy is much more helpful at this point. One of the weaknesses they identified in this research article was that the therapists that were engaging in helping the youth with functional family therapy, there was some variance in the way that they were adhering to some of those functional family principles, and so they thought that possibly that could be an issue, and they would have to maybe continue in this area of research and make sure that therapists were being consistent across the board. The last study that I looked at was a pilot study that looked at applying functional family therapy to 12 families who had children with cerebral palsy. The children were 18 months old to 5 years of age, and it was looking at whether the parents could, at this point, a little bit take over for their children and help develop some of those goals and have positive results with motor-based goals. And the study showed that it was positive. Parents were able to develop a lot of these goals with the help of introducing functional family therapy to their lives, and it showed that as far as pilot cities goes, there's a lot more areas for research, and that this could possibly be a really good intervention to use with families with children with cerebral palsy. And
All right,
these
so
are
these
all
are references. All right. Thank you for watching.